Hi everyone, my name is Jocelyn Vergara. I brief introduction about my background in healthcare. I am working in critical care right now in the PACU in an ambulatory surgery center. I've been there since last year, since June of 2019. I am a new grad. I graduated from Pacific Union College with from the ADN program in December of 2018. I decided to stay in the same school to do my bachelor's, my BSN, and I just finished that last month, 2 weeks ago. And I am very excited to have finished that, and I'm also very excited to be enrolled in Loma Linda with in the BSN to DNP family nurse practitioner. I have some personal information that I would like to share with you. I've been married for the past 7 years to a wonderful and lovely husband, and I have a 5-year-old boy who is very energetic, um, whom I love to spend time with. This quarter, I look forward to meeting you all during seminar week, and also looking forward and working with all of you, not just this quarter, but during the rest of the program. This is my first quarter in Loma Linda and first quarter enroll in the BSN to DMP, and answering some of the questions. And the first question: what purpose does the government serve? The purpose of our federal government, as found in the Constitution, is to establish justice, provide for the common defense, promote the general welfare, and secure the blessings of liberty to ourselves and our prosperity. In order to achieve this purpose, the founding fathers established three main principles in which our government is based. These three principles are the inherent rights, the rights that anyone living in America has, the self-government, government by the people, and the separation of powers, with the three branches of governments with different powers. Government originated with the need to protect people. The government protects people from conflict by providing law and order. The important purpose of government is protection, which includes national security and personal security by doing laws that can prevent harm and crime. Also, the government does this by providing a safe infrastructure, care for the sick and elderly, and corporate regulation so that transportation, medications, products, and premises are safe for its citizens. Also, to promote the general welfare, it's another purpose of the government. And the purpose of the government is to share responsibility in the economy and public services. The government serves the purpose to balance the interest of the individual with the interest of the community. The purpose of the government is to allocate resources such as healthcare, education, and to provide equal opportunity to all. The government serves the purpose of balancing the goals and mixtures of health policy for society. Moving on to our next question: what values are in conflict in regard to government? One value that is always in conflict is the value of liberty. The government puts the safety of the community against individuals' liberty. So individuals must give up something like taxes to gain state protection. And this value is good as long as our liberty or freedom, such as freedom of speech, for example, don't interfere with the liberty of others. We strive to achieve equal and fair opportunity for all people and are committed to dismantling structural barriers to equity for women, people of color, religious and ethnic minorities, people with disability, LGBTQ community, immigrants, and others who face discrimination and injustice. Some values that are always in conflict include economic values and value of equality, especially when it comes to distributing wealth and opportunities. All the families in this country pay taxes, and every individual think different in how the government should allocate resources, benefits, services, and taxes in the United States. This is well viewed with the two-party systems that we have with the Republican and the Democratic or Democrats, which are always opposing in ideas in how the government should be run and how the government should allocate the resources. So this value is important, and it's always in conflict when it comes to allocated policies which provide net benefits to some distinct class or group at the expense of others to meet public objectives. Another value that it's in conflict is self-government. Citizens have a say in how the government should be run. They are the primary source of government authority, so the government exists to promote well-being. Moving on to our next question to explain the connection between health, determinants of health, and health policy. It is very important to understand this connection, and to do that we can start by defining what each one of these concepts are. In our book, in one of our books, in Lungs, there is a definition of health, and it's coming from the World Health Organization. And it says that health is defined as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So understanding the definition of health will give us a purpose when it comes to considering any health policy. The determinants of health are factors that affect health at the personal, social, economic, and environmental level. In one conceptualization, the determinants of health can be divided into two categories. One is the fixed or unchangeable factors such as age and race, and in another category we have the modifiable factors, which include lifestyle and social networks, for example. So in order to define health policy, it is important to define public policy. The same book, according to Lungs, policy or public policy is defined as authoritative decisions made by the legislative, executive, or judicial branches of governments. They are intended to direct or influence the actions, decisions, and behaviors of others. Health policies, then, are those public policies that pertain to health or influence the pursuit of health. They can be made at the federal, state, or local governments. Policy affects health through its impact on determinants of health. It is important to note that the value we place on health is proportional to the available resources to pursue health here in America. One of the ways we can appreciate how health policy, and health determinants are interconnected is that health is simply a function of some variables called health determinants, and health policy affects these health determinants. Health policies are a way for the government to intervene in the pursuit of health. Health policies affect health by intervening in a set of these variables. For example, regulating the environment in which people live and work, availability and access to health services. For instance, when people are exposed to harmful agents such as asbestos, excessive noise, chemical or biological substances, their health is directly affected. Then it is the government's responsibility to create health policies such as the Occupational Safety and Health Act to protect individuals. This is why health policies that mitigate environmental hazards or take advantage of positive environmental conditions are important aspects of any society because it helps members to achieve health. For example, environmental policies deal with determinants of health such as hazardous materials, particulate matter in the air or water, and safety standards in the workplace. An example found in one of our books from Milstead 2019 is that how defense policy is related to health policy when developing, investigating, and testing biological and chemical weapons. It's another great example. So therefore, we can say that from the government perspective, we can say that the central purpose of health policy is to enhance or facilitate its pursuit. So health policies should exist to support people to pursue health. Health policy affects health services, availability of and access to health services. Health services can be preventive, acute, chronic, restorative, or palliative. Health policy is a very important because it helps in the production and distribution of health services, including money, workforce, and technology, which we know that there are many different organizations and networks that transform these resources into health services and distribute them into health services to consumers. Of course, this is what we know as the health system. Another way why these concepts are interconnected is because by influencing health policy, the government can contribute to health of its citizens. For instance, promoting campaigns to prevent or quit smoking can help people eliminate some of the modifiable factors in the list of health determinants. Another example can be public laws or regulations, for example, mandating child restraints and seat belts. And by doing this, the government can be preventing death or simply promoting life or preventing premature death. And this way, health policy is intervening in promoting health to a certain extent. So therefore, we can say that from the government perspective, we can say that the central purpose of health policy is to enhance or facilitate its pursuit. So health policy should exist to support people to pursue health. All right, so this is it. Thanks for watching. I look forward in meeting you all during the seminar week, and I look forward in working with to work with all of you this quarter and throughout the rest of the program. I also pray that we all work hard and together to achieve our goal. All right, thanks.